Here today. I am going to be talking up all about tongue ties, lip ties, and cheek ties. This is something that I get not necessarily a lot of questions about, but I see a lot of because in my work with sleep, in my work with reflux, also in my work with infant craniosacral therapy, tongue, lip, and cheek ties are something that are oftentimes um, there and causing issues like reflux, causing issues with lats, causing issues with sleep. It's all connected. And so I wanted to do a separate video today, just introducing you to the idea of tongue, lip, and cheek ties, and also how to help you just do a very cursory check inside your baby's mouth to see if maybe there's something that you want to get assessed further. I 100% highly recommend getting. I think all babies should be assessed for tongue, lip, and cheek ties, which as a whole are called tethered oral tissues, or TOTs for short. But it's something that I really feel all babies should be properly assessed for. And I'm sorry, but the whole in the mouth quick peek that you get at the pediatrician's office is not enough. Really, somebody should be going inside the mouth, lifting the tongue, lifting the lips, and really feeling what's going on inside the mouth before they tell you that yes, your baby has, or no, your baby doesn't have. And unfortunately, that's just not happening a lot of the time. A lot of the time, they're just looking out, or I hear this all the time, something like, oh, your baby can stick their tongue out, so there's nothing wrong. Everything's good. And you're like, well, here's the thing, guys. My daughter is 4 years old, and we are going on Monday to get her assessed for a tongue tie because of all of the training that I've done with tongue ties and pre and post frenectomy, which is the sort of little minor surgery that you do to release the ties. We're going to get her assessed for that at 4 years old. Why? Because we didn't actually have any breastfeeding difficulties when she was little. I vaguely remember the midwife saying something like she maybe had a minor tie when she was born. But because we didn't have any breastfeeding difficulties, it was never something that really crossed my mind. And when I got trained in tongue ties, I went inside her mouth and I did a little look-see, and I was like, oh, I think she might have a tongue tie. And so we're going to get assessed. And it makes sense now to me because she was a late talker. I have always been her interpreter, I call myself, when she talks, because a lot of time other people cannot understand what she's saying. Even sometimes I can't fully understand what she's saying. There's also instances where she'll actually be eating and she'll spit out her food, especially meat. And I'm now thinking that that's because she can't actually manipulate it inside her mouth. Her tongue is not moving properly to be able to do the chewing on the back molars. And so there's just all these little things that are leading me to think she grinds her teeth at night. She's a pretty restless sleeper. She does mouth breathe sometimes. So these are all different symptoms that we're like, check. Okay, time to go and get her further assessed by, we're actually going to her pediatric dentist who also does tongue tie releases. Okay. So you might be thinking like, wait, what are you talking about? What are tethered oral tissues or TOTs? So again, what tethered oral tissues really are really short, tight, or thick frena. So we have these things called frenulum, like under the tongue here. That little band of tissue, you have it under your lip there. And you also have them sometimes inside your cheeks. And so one on each side at the top and one on each side at the bottom. And what happens is that when those are too short, or maybe they're too tight, or they're thick, and they are really restricting the movement of your lips or your tongue, or even they're restricting the movement of your cheeks because they're so tight and your cheeks are very tight. This is then called a tethered oral tissue, um, which can lead to a lot of different things down the road. And the key here is that because the frenulum are all normal, right? Like we all have those bands of tissues, but the key is that they are short or thick or tight and they're affecting function. Okay. So remember, I just told you that my daughter, we didn't really notice that it was affecting her function when she was a baby because breastfeeding was fine. She was a pretty good sleeper. And I didn't really have any concerns then. But now, over the last few years, as she started to use her lips and her tongue and her mouth more, now I'm starting to be like, oh, there's some things that I'm noticing that are some red flags that might show me or let me know that there are these something going on with the oral function of her mouth. Okay. And this is why it is so important for somebody to actually get their fingers inside your baby's mouth and not just look, right? Because by looking, you're not going to know if the tongue is moving properly. You're not going to know if the lips are moving properly. You're not going to know if there's tightness in the cheeks, okay? So, what can these things lead to? So, various symptoms that you might see from a baby who has tethered oral tissues could be cracked or bleeding or painful nipples for you. Maybe there's clicking. Maybe there's your baby always has milk dribbling down their mouth as they're feeding. Reflux. This could definitely be an underlying cause of reflux because if your baby has a poor latch due to the tethered oral tissue, then they're going to be getting more air in as they're feeding, which is going to cause more pressure in the belly, which is then going to cause some of that reflux to come out. Same thing with colic. It might be because of tethered oral tissues. If you have an older baby and they are starting solids and you're having a lot of difficulty with the solids, that could be because of the tethered oral tissues. Sometimes frequent wakes, restlessness, difficulty staying asleep, those can all be signs of tethered oral tissues. The other thing is that often tethered oral tissues and specifically tongue ties are also often related to head shape differences, like the plagiocephaly, which is the flat head on one side, or the brachycephaly, which is the flat on the back. As well as torticollis, which is tightness from the neck to the hip. It's not just in the neck usually. So a lot of times, because the tongue is one of the first things to develop in utero, if the tongue is not moving properly in utero, then your baby is going to have all of these restrictions while they're developing in utero, and then you'll notice them a little bit after birth as well. So that's a little bit more about the tongue and the lip ties. Now, I told you that I would let you know there is a way to just very, very briefly check inside your baby's mouth. But one of the big keys to really look for is, does your baby have an open mouth posture when they're at rest or sleeping, or are their lips closed? Ideally, what we want is we want our sleeping posture and also just when our body is at rest. So if we're awake and calm, you really want your mouth to be closed, so lips closed and tongue to the roof of the mouth. Okay? You can't really see what my tongue is doing, but it was to the roof of my mouth. If your baby is like this or like this, most of the time, especially when they're sleeping, then their tongue is not actually to the roof of their mouth. And they're not closing their lips. And that means that they're not actually getting the proper airway patency because their structures in their mouth and their throat are not doing what they should be doing. They're also not getting the formation of the palate properly. And so this is one of the first signs to look for is, do you have a baby who is a mouth breather? Okay. Most likely they're a mouth breather because their tongue is actually tight to the bottom of the mouth and that's pulling everything down. Okay. It could also be as a result of sometimes your baby having tightness in the front line of their body. So babies are really scrunched in utero for a long time in the womb. And when they're born, they want to be extending and stretching and all of these things. But if there is any residual tightness that doesn't get sort of relieved with all of the stretching, that sometimes can also pull the tongue down, even if there is no tie or no tight or short or thick frenulum, it could be because of tightness somewhere else in the body. So body work is really important as well. I personally love craniosacral therapy, but also, infant massage, infant like pediatric chiropractor, they can all help. But craniosacral therapy is one of the key ones to do first, I often find, because then things like the chiropractic adjustments can really take hold a little bit more strongly. The other way to check at home is literally with a clean finger. I'm going to just pretend my finger's clean. You're going to put your finger inside your baby's mouth and you're going to literally like run your finger in their cheeks. Do you feel any restriction on both sides? You're going to see, can you lift your baby's lip? It should touch their nose. If it doesn't, there's probably something going on there. If the frena here comes down really into their gums or around the gums and is really tight and you can't flip, it's called phalange, the lips, then that might be a possible lip tie. You also want to run your finger underneath their tongue. And if you come across sort of a speed bump or your finger kind of gets stuck, then there might be a tongue tie going on there because of a tight or thick or short frena. Sometimes the tight piece is right at the tip and you'll actually see sort of a little divot or a dimple inside the tongue. Sometimes the tight frena is closer to the back. That's what my daughter has, I think. Posterior. That's called a posterior tongue tie. And sometimes it's submucosal. So you really can't even see it until you put your fingers all the way in. So there's lots, but this is why it's so important to get an in the mouth oral motor function assessment to see if the tongue and all of the mouth is really working the way it should be. So that's it for me today because I wanted to keep this video nice and short, but you now know a little bit more about tongue, lip, and cheek ties, and they are quite common actually in babies. I think I've even read that up to like 50% of babies anecdotally have been having these tongue, lip, and cheek ties. And really back in the day, midwives used to have a really long pinky, like way back before my time, have a really long pinky, and they would just clip the tie at birth. And it was just the thing to do. I think in Brazil, they actually have a mandate that every single baby that is born needs to get a full assessment to really assess for these tethered oral tissues. So it's not just a fad that you might be hearing about. It's not just a made up thing. It's really something that can impact your baby's function. It can impact their sleep. It can impact reflux. It can impact their ability to eat, to communicate, to do all of the things. So it's important to get this checked and to rule it out. So now you know a little bit more about sort of really just cursory things you can do to check for at home. But I highly recommend if you do that check inside their mouth at home and you're kind of like, oh, I don't know, maybe there might be something there, please go and get it checked out by somebody who is qualified to do that. And oftentimes that is not necessarily your pediatrician. It really should be someone, an IBCLC, so an International Board Certified Lactation Consultant, pediatric occupational therapist, or pediatric speech language pathologist, but really make sure that they have the training to assess for tongue ties. It's not all occupational therapists or all speech therapists that have this specialized training in tethered oral tissues. You can also, sometimes pediatric dentists will have the training as well. So you just want to make sure that they have done additional training for the tethered oral tissues or the TOTs before you ask them to do the in-mouth assessment. That's it. If you have any questions, please feel free to come on over to the Sleep Deprived Zombie Mamas Club, community, whatever you want to call it, over on Facebook. Ask all your questions there. You can post them in the comments below or above this video, depending on where you're watching. And that's it for me. Bye, everyone.